So very few points about congenital dengue, which behaves very notoriously. So actually there is very limited literature and data about this congenital dengue, but slowly there is increasing number of evidences of vertical transmission of virus from mother to fetus, which ultimately causes leads to perinatal mortality, morbidity and mortality. This dengue infection during pregnancy, it can lead to preterm labor, low birth weight, miscarriage and stillbirths. So what is the time frame we have to be aware? This vertical transmission has been reported and should be considered in cases where illness in mother occurs 10 days prior to delivery to 10 hours post delivery. So during this time frame, we have to be aware and consider about the vertical transmission to the fetus. So this intrauterine transmission is high, especially when the mother is in the febrile phase, because viral load is more during the febrile phase. So that is the time where there will be more transmission of the virus. The affected neonates may become symptomatic up to 11 days because the incubation period is 3 to 10 days. So does the mode of delivery affect the rate of transmission? No, mode of delivery does not affect the rate of transmission. Dengue virus has not been shown to cause any congenital abnormalities. But if suppose dengue fever occurs during the organogenesis time, during the early trimester, studies have shown that it might cause spontaneous abortion or neural tube defects. So coming to the signs and symptoms, dengue can be as simple as baby can be asymptomatic, but it can be as devastating as it can lead to many hematological, cardiac and pulmonary complications, ultimately leading to mortality. The common presentations are like the baby may present with fever, erythematous maculopapular rashes with petechiae, and lab shows thrombocytopenia, leukopenia, bleeding manifestations can be there, organomegaly and transaminitis. So coming to the case which ma'am was talking about, which we managed 2 weeks back. So it was a male baby born by a normal vaginal delivery. The birth weight is 2.3 kg. Baby cried immediately at birth with Afghars 7, 8, 9 at 1, 5, 10 minutes respectively. So baby is very comfortable on room air. We were shifted to step down for observation. At 8 hours of life, baby started developing fever. So baby developed fever. Later, baby had asymptomatic hypoglycemia. The sugars were very low. Initially, I started on full oral feeds, but then we had to go up on GIR, increase the GIR and dextrose concentration. Later, almost we went up on to GIR of 10, requiring dextrose concentration of 18. So I had to secure central line on day 1 of life, and I noticed lot of time active bleeding was happening from the site of where I was trying to secure the PIC line. So then I have sent the coagulation profile, which showed INR of 2.5. The baby required FFP transfusion, and platelets on day 1 of life is 98,000. On day 2 of life, the platelet count dropped to 80,000, but there were no further bleeding manifestations. And on day 2 of life at 48 hours, we have done creatinine, which the routine labs we do RFT, was showing creatinine of 2.8. The next day it went on to become 3. It was actually non-oliguric KK because of some intrinsic cause. But from day 3 of life, at 72 hours, baby started responding clinically. Baby became more active. The platelet count started in an improving trend from 1.3 lakhs and so on. Even creatinine has started to come down. We are able to come down on GIR. We have started the feeds, slowly graded up to full feeds. So by day 5 of life, almost the platelets were 2.4 lakhs, and the baby and mother both were discharged on day 7 of life. During the time of discharge, baby platelet was more than 2.5 with a creat of 1. Breastfeeding was established. Baby was very active. Even yesterday they came for review. Both of them, both mother and baby are doing very well. But this baby did not trouble much. I have seen a couple of cases during my training days where one baby, term baby born of 38 weeks gestation, baby was very stable till day 4 of life, then started having fever. Later developed severe thrombocytopenia with a platelet count almost 11,000. Later went on to have deranged coagulation profile, went into coagulopathy, ultimately landed up in DIC, and later developed pulmonary hemorrhage. We had to ventilate and went into shock inotropes, but nothing worked. The baby ultimately landed up in mortality. So we as a clinicians have to be aware of this dengue fever, especially should be aware about the congenital dengue, and the baby also should be monitored closely. A baby born to a dengue positive mother. Thank you.